Adjustments to the Med Nasal Splint. Adjustments of the Med Nasal Splint are dependent on the specific patient's indications. The Med Nasal Splint can be moved up the nose to avoid compression of the nostrils, or moved down to include compression of the nostrils. The Med Nasal Splint can be opened wider to reduce compression or narrower to increase compression. The Med Nasal Splint's distal panel's corners can be bent upward to reduce or avoid nostril compression. These adjustments can be manually performed by hand or instrument to best suit the patient. In some cases, where greater all-around compression is required, a smaller Med Nasal Splint size can be used. These adjustments can be made for compression to the nasal walls, nasal dorsum, or nasal tip. This patient is wearing S size on the left and XS on the right. The Med Nasal Splint's dorsal pads can be used to increase nasal dorsum compression as well. Both the foam and clear silicone pads are suitable for this. As no two noses are alike, the Med Nasal Splint's wing portions can be bent according to the shape of the patient's nose and the eye socket positions. Alternatively, the splint's wing portions can be straightened. This allows for extra length and can provide a perfect match to the patient's nose. Med Nasal Splints. We care about noses.